Welcome to my favorite nonprofit radio segment called Nonprofits Care. Their causes are really extraordinary.
Good morning and welcome to our new show called Nonprofits Who Care, and CARE stands for Causes Are Really Extraordinary. I'm Ralph Grills. I'm the founder of My Favorite Nonprofit at myfavoriternonprofit.com, and today we have our co-host Elena Nee. Hi Elena, how are you?
Good morning, I'm grateful.
Welcome. And we have a very special guest today. His name is Cosmas Agu. And Cosmas is with an organization called ACUSA. And can you explain a little bit, Cosmas, what ACUSA is all about?
Yes, ACUSA stands for Animal Community USA. And what that means, it's an organization that's a non-profit 501c.
501c3?
501c organization here in the US. And we've been here, we've been an organization for the last 5-6 years.
Oh, really?
Our Colorado chapter was born a few months ago, so in Colorado.
So it's Amino Community.
It's Amino Community.
Amino Community.
Ammo.
Imo.
That's right.
Amino.
Yes.
It's kind of hard to pronounce.
That's all right.
What is that community?
We are from the Igbo tribe, which is one of the tribes in Nigeria. There's 3 major tribes in Nigeria: the Hausas, the Igbos, and the Yorubas. And the Igbos are one of the tribes, tribe, very struggling people.
So are you like a segment of the Igbo tribe then?
Exactly.
Oh, okay.
Amino is a segment of the Igbo tribe.
And how many members are of that community?
You mean in over there or here in the U.S.?
Over there in Nigeria.
Over there in the Amino people in the tribe, there's about 45,000 of them.
So that's a good sized tribe.
That's a good sized tribe.
Or a good sized segment of the tribe.
Segment of the tribe, yes.
Wow.
Exactly.
Okay. And so what does your organization do to help out over there in Nigeria?
Well, what our organization is doing, we're doing literacy, helping with education.
Mm-hmm.
Also, we're helping we do medical missions. We do medical missions every year. We do medical missions back home. Then the major one that we're doing down the road, which is why I'm here, one of the reasons why I'm here to get the word out, is we're building, our plan is that's down the road, next few years, to build a hospital for the people down there.
Okay, so this isn't something that's started yet, but you're going to be doing this in the future.
It's in the future.
Okay.
But we're laying the groundwork now. We get it, at least we get it in people's ears so they know, because it's not easy to build a hospital.
Exactly.
And we are aware of that, so
right.
we might as well get people know so that we get the resources and we get a way to go about it.
Have the plans been designed for the hospital yet, or?
The plan hasn't been designed yet.
So just the idea, let's get a hospital. Okay.
Yes.
Very good. And so you say you have people that go back with medical supplies, and didn't you already talk to an organization called Project Cure?
Exactly. I met with one of the staffs at Project Cure. I mentioned what we're doing. She said definitely when we're ready, that they're ready to help us with the medical supplies, equipments.
Great.
So I'm like, wow, if that's possible, then everything is possible.
Yes, for our listeners who don't know, Project Cure is an organization based here in Colorado that ships medical supplies throughout the world to developing countries. And they have shipped, like last year, over 50 million in medical supplies throughout the world. So they're a fantastic organization that we are very fond of. They're actually a group on our site at myfavoriternonprofit.com, so you can find out more about them there as well. Tell us more what you guys are doing out there, Cosmas.
Well, like the medical missions, what we have our own people that go every year on a medical mission, women and men in the medical field, and we have non-medical people like myself. Some of them go home with them every year to help. Give you an example. Last year, they went home. They took a group, the medical mission that was home, took care in one day. They took care of 2,500 people.
2,500 people in one day?
One day.
How's that possible?
They were overrun. Yes, they were overrun. They were just, you couldn't take care of all that many people.
Right, so just when you got there, you had 2,500 people
They were waiting.
waiting.
I didn't go with them, but the group that went just had to shut down. There was no way you could see all those people. So it bleeds my heart when you see that happen and you leave without taking care of them.
Yeah.
The whole idea of the hospital is that you'll be able to keep track of who you took care of.
Right.
You're not just going and dumping medicine on them, but you want to take care of them and keep that track.
Right.
Yeah. Because I know Helena went back to Cambodia to help people in her village, and she said that same thing happened to her.
Yeah, it's never enough.
Never
You can
enough.
give everything you have, and it's never gonna be enough.
Exactly.
So, what's your personal experience with this?
Well, my personal, I get very emotional about this, Elena, as you can tell. I am very emotional when it comes to this because I've been here since 1973. I came to Colorado in 1973 on the dream of going back after I finished college and I graduated. I have 4 children, grown children here that are doing very well. But to me, that was not enough. And America is such a great country. They spend so much money helping other people. And with the way the economy is right now, my dream and the dream of Akusa is that we have something that will be set for our people, that will be there for them. In that way, we have something to, we're very accountable to, so that you go back, you're like, oh yeah, we have a hospital, and look how many people we've taken care of, instead of just dumping the medicine on them and not being able to keep track of who we've taken care of. And that is why I am so emotional about this.
Because you are the president of the chapter here in Colorado,
in Colorado, yes,
right?
in the new chapter that was formed.
Do you work for the Akusa then full-time then?
Well, it's a non-profit organization.
Uh-huh.
Yeah, I'm with them full-time, whatever it takes to make things happen.
Well, a lot of organizations have full-time staff. Like if you look at the Denver Rescue Mission, people are paid to work there. It's a job, but they are doing
We're non-profit, we're not paid.
Oh, you're a volunteer?
We're all volunteers.
Yeah, because there's a lot of nonprofits that do pay their employees and staff, just like a business. But they do that to keep people so they can run their organization.
Yeah.
But you're just doing it on a volunteer basis.
We're all volunteer.
Do you work somewhere else as well then?
Yeah, I work in financial services.
Oh, very good.
Company. Times are tough, and that's why we look at all the options that are available to us and pray a lot and work hard like it depends on us.
Right. Well, I know a lot of nonprofits right now are having financial struggles because of the economy.
Exactly.
So, things like this, we want to help you get the word out. That's why I'm doing the radio show here, and that's why Elena's helping out, so that nonprofits can get their word out there. Because if people don't know you exist, they're not going to be able to get involved with you at all. And that's the reason we formed My Favorite Nonprofit, because there it's a site where people go on and find different nonprofits to get involved with, which will have you on the site so that people can find you as well.
Yeah, we're very grateful.
Yes.
Very grateful for this.
What is it like in Nigeria with the condition how people live?
Well, Nigeria is a country where there's people that are very wealthy and the people that are very poor. There's no the middle class is very non-existent. And because of that, I still find a lot of people that don't even have good water and electricity. And so when I look at that dichotomy, it really hurts. It bleeds my heart that to see people suffering like that. And anything that I can do or Akusa can be part of, we definitely will do it to help that part of the world. And hopefully it helps everybody in the process.
Okay, are there already hospitals there though?
Well, there in the village where I'm from Amimo, we have, I think we have 2, what I call quasi hospitals. When I say quasi, they're hospitals, but they're not equipped. There's nothing in them. They're small, little shanty places. There's no medical equipment per se.
So they don't really have any medical supplies?
There's so much politics. And we want to have something that we can call our own, that we can keep track of, that we can go home and say, hey, this medicine is for our people and take care of them, and then be able to continue with that. Because we have an incredible lot of people in the medical field, doctors. My wife is a nurse. We have doctors and people in the medical field here that are ready to go and help. But they want to do it and see the results and make sure it's working well instead of just dumping medicine over there and wasting more money. So that's the goal, that's the prayer we look forward to. That's what we're working at.
So there's a lot of medicine coming into Africa, but it's really not going to the places where
Exactly.
it can do a lot of good.
Exactly.
And so by building this hospital, you guys can control what's happening with the medical supplies
That's
and everything else. Well, that's great. That's a good idea.
How big is it going to be?
Well, we're looking at about 30, 40 bed hospital for now. Our goal is establish a clinic, have a lot of space for expansion.
Right.
And that way we expand as we get successful as time goes on. I see the dream is such a great way, and I see it working.
Nice.
Okay, and what's your website that people can go to find more information about you?
Sure, on the Akusa website. Okay, it's Akusa webs.com.
So that's akusa1.m.webs.com.
That webs.
Webs plural, right.
Webs.
And I'm looking at the site right now. It has the Amino Community USA. It has your mission statement. Is there a place that someone can come on and donate here?
Actually, you can do that on that Akusa. And there's also a phone number out there too.
You want to give the phone number out?
At 407
Mm-hmm.
247-9497. That's our the lady who's in charge of the medical missions.
Medical Nations.
Medical missions. She's
Medical
one of the
Nations.
ladies on the. She's the.
Is she in
medical
Houston?
mission she's in Houston.
Okay,
But she lives in
Houston.
Florida, but she's.
Oh, she's in Florida,
Florida,
but she
yeah.
works out of the Houston
Yeah,
office.
she's a MD. She's a doctor in pharmacy.
Oh, very good. Yeah, because actually you have your corporate office for Akusa out of Houston, right?
That's correct.
Right.
That's where we are incorporated.
Right. And who's the president of your organization?
His name is Chief Godi Abuachi, Abuachi.
Okay, and he's
based in Houston, Texas.
the chief of the village then, or?
Well, he's a traditional chief.
Right.
Yes.
Oh, very
He's
good.
one of the chiefs. We have plenty.
Yeah. And how many times have you gone back?
I've gone home about 4 times since I've been here. But not enough. I like to go home.
Yeah.
There's a need for it.
So what I understand from Ralph yesterday is that this project is, you actually have all the people from your tribes doing this together?
Yes.
How many are the people from your tribe here in the U.S. that are helping you right now?
Thank you. That's a good question. Actually, right now, the number of people, we have about 100 families
Wow.
in the U.S. that are registered part of this group. There's more of us, but some of them are not part of the group, but they're coming aboard as they see what we do.
Nice.
So you're setting an example for others to say,
Exactly.
hey, here we are.
Somebody have to start it.
Right.
Yes.
Yeah. See, I believe in the medical missions, but this is going to be more lasting effect. You know,
Right.
it will set something that we can hold on to
Yeah.
and pass to posterity.
So you can keep your heritage
For the
going
heritage going.
and this culture, and then still keep your culture and going back and helping people there. at the
Were your
same time.
children born here?
All my kids are born here. Thank you. All my 4 children are born here. I have 2 daughters and 2 sons, all born here.
Have they gone back and seen?
Yeah, we took them home 10 years ago. It was tough to do, but we took them all home, and I'm thankful to my wonderful wife for making that happen. And they're very grateful that they went home.
Wow.
What did they think when they saw that?
Well, they thank God that they live in America.
Oh, yeah, I can imagine.
Yeah.
Makes them appreciate more what we have here.
More what we have in this
Right.
country. That's for
Yeah.
sure.
Yeah, we're always different than, I mean, even turning on the light switch or going to the bathroom at night, we're so grateful. Like in our head, because we have that reality and then we have this reality.
Yes.
The people that are born here don't have the other reality. Unless you talk to an elderly that was born before all the bathroom was built in the house. The kids, I bet they
Oh, yeah.
get an eye-opening when they go there.
Oh, yeah.
If I have kids, I would take them to Cambodia as well,
Yes.
so that they can see
Oh,
they never come back the same person again. Even adults, when they go to Nigeria or they go to Cambodia, they go to anywhere that is third world, they don't come back the same.
They change people.
Yeah, it changes people.
I can imagine. That's great. What else can you tell us what you guys are doing?
Well, I tell you what, on the we do a lot of scholarships. We have done scholarships for a lot of young people that don't have anyone to help them. There's so many intelligent young people back there, very creative, but they don't have the funds to continue with school. That is an ongoing project we have to raise money to help.
So it's a waste of their mind because they can't even go to school to expand
Exactly.
things.
That's
yeah.
what a waste. You know. And the education system over there, our goal is to improve it. And anything we can do to make life a lot easier for the people. Because I look at it this way: any ship that a good word, any ship that rises, as long as the ship rises, the tide will raise all ships. Any ship that raises, the people
It brings
that
other ones with them.
Exactly,
Yeah.
and that's what we're doing.
Yeah.
Thank you. We're doing that. I'm lack of words here, but anytime you help them, you all like this. We all in this together. And America is such a great country, and people that come here, America is better because they can.
Right.
America is a greater country because everyone came from somewhere.
We're like a melting pot of all different nationalities, of creeds, of everything, religion, and then we're able to get along. And I think that's what really puts America ahead, is because we have so much creativity from different areas that we draw from,
That's right.
versus like the same communities.
Exactly.
Yeah.
And that's what, there should be little America everywhere. I think we should
Yeah.
have America all over the world.
I agree.
I think that's already happening, like with you guys, what you're doing.
What are we doing?
There's a lot of organizations here in the United States that are helping throughout the world that are from people that are from those countries
Yes.
that are founded there. You know, there's a thing here in Colorado that have the dragon boat races, and that's for the Asian community. It's all the Asians in the community.
Yeah.
And I met the lady at Project Here who's helping over there that actually founded the dragon boat races. Mrs. Lee. And she actually wanted to bring all the Asian communities together, and that's why she started that organization. So that's
beautiful.
great. But what we're going to do is we're going to take a break right now.
Okay.
And after the break with Cosmos, we'll talk some more about what's going on. This is Ralph Grills with My Favorite Nonprofit. On the show, Nonprofits Who Care, Causes Are Really Extraordinary.
Thank you.
Welcome to my favorite nonprofit radio segment called Nonprofits Care. Their causes are really extraordinary.
Welcome back to My Favorite Nonprofit. This is a show segment called Nonprofits Who Care, Causes Are Really Extraordinary. And we're here I'm Ralph Grills, the founder of My Favorite Nonprofit. My co-host is Lena Nee. And we have Cosmos Agu, who's here from Nigeria with a program, our organization called ACUSA. And he was just talking before the break about what was going on with Nigeria and his tribe there. Why don't you tell us a little more? You said the water is a real problem. Are you guys doing anything with the water issue there?
Well, there is a few things that have been done with the water. However, there's still issues, and like I said, it's always one thing after the other.
Mm-hmm.
There's always improvement. We even have waterborne well waters to make it. Some people have they drill their own wells to have their own individual, but then the government is doing the best they can.
Right.
But under the situation, it's still a lot of work to be done.
Yeah, because I know a lot of the students don't go to school because of the lack of water, especially the girls there, when they become of age, when they start their period, they really feel embarrassed, and so they don't go to school. So if they had some fresh water, I think that would help.
That would
A
help.
lot of different areas,
Definitely.
especially in the medical arena. If you have a hospital, you need water there as well.
Definitely.
Yeah. What else can you tell me about ACUSA and what you guys do?
Well, I tell you what, I am, ACUSA is such a great organization, especially spearheading what they've done with regards to the medical missions that they do every year, because that is a sign of helping the families. And also, like I said, with a good example, okay? People, I can give you a few numbers here, okay?
Okay.
Like we're talking about the
Statistics here?
death situation.
Mm-hmm.
People are dying like flies, and burial services keep the priests and pastors quite busy. Isn't that something?
Yeah.
Preventable diseases such as diarrhea, malaria, and malnutrition takes a heavy toll on it. Recently, diseases such as diabetes, high blood pressure, and cancer have become quite rampant. HIV and AIDS also become prevalent.
I was going to say, is there a big AIDS problem in Nigeria?
There is.
And in also your community?
Yes, there is. There is. Not in our area, but the surrounding areas.
Right.
But everyone is related. Everyone is your brother and sister back there.
Exactly.
We are very close related. So it's not uncommon to hear about the next person has AIDS, but they won't let you know because it's a taboo to know you have AIDS.
Oh yeah, because then everybody runs away
hide
from
them.
you.
They put them.
It's like the plague.
It's exactly.
Yeah.
Hide the people somewhere. They won't tell you what's wrong with them until it's too late.
Oh
Right.
my God.
And that's what we face every day.
Well, I know Bill Clinton has the Clinton Foundation,
Yes.
and they help a lot with AIDS and bringing medicines over there. I don't know how they get them out and distribute. That's the problem, I think, because like if you had your hospital, you guys would be able to distribute them to the people that really need them.
Exactly.
Because you could diagnose them early, and instead of try to hide them, you can actually try to heal them.
That's correct.
And that would be the way to work with them.
Exactly.
Yeah.
Exactly.
Okay, continue.
Something else too, there's a high infant mortality rate due to poor maternal and prenatal care, you know. When a woman is pregnant, at the onset, if you take care of her from the onset of pregnancy, there's a good chance that the baby will come to full term and you have a healthy baby. But if the woman is not healthy, then that affects the child under 9 months while the woman is expecting that baby. So all those things are the things that we're looking at.
And then personal hygiene is, I think, is a big issue there.
Hygiene.
Because when they change the diaper and then there's the bacteria, and
Exactly.
then the baby gets it, and then that causes a lot of problems. Especially because their immune system's very weak at that point.
Exactly.
And so they need a chance to really build their immune system.
Yep, that's exactly right, the death rate is another thing too, there's an indication of statistics of deaths that are not available, however, there's a National Bureau of Statistics in 2008 Nigerian demographic situation reported that 0.2% to 0.5% per year, the death rates are reported every year.
The death rate?
Death rate. So that's a lot.
Yeah.
This will translate to about 113 to 225 persons per year dying of things like this in a little area. From the tales of death in the town, the right figure could double between 225 to 450 per year in that area. And so that is the thing that we worry about. We want to be able to do as much as possible to
Try to control that.
To control that.
Well, that's why I think the medical supplies in the hospital will be very important, because a lot of these things can be prevented with just simple items.
Exactly.
Which the Project Hero will be a great collaboration.
Collaboration with us.
Yeah.
So we're also looking at transportation. Transportation has already been difficult. It's difficult, and there's practically no ambulance. There's no ambulance there. Yeah, there's no ambulance.
So if someone has a medical injury, they're not going to be coming to get them.
They can't get you there on time, but there's no ambulance services. So these are some of the things that we're looking at, But once we have a hospital, other things will come in place to facilitate that.
Right.
And, that's our goal.
How big of a hospital are you guys planning to build initially?
We are looking at 60 to 80 bed hospital, including pediatrics, female and male adult wards. So that's what we're looking at initially. And then as time goes on, we're going to grow up a little bigger. Actually, we'll probably have a little clinic to start with, because I tell you, the moment we build it, we're going to have a lot of people coming to it right away.
Yeah, I
So
believe that.
the need is so incredible.
Right.
But we just have to study, even if it's with just 10 beds, and then we just have to have enough room, space, so that we can always expand into the land.
So you can grow as you guys get more
Expand.
funds and resources.
Exactly.
And how are you getting funding for Akusa right now?
Well, like I said, what we're doing, we started, actually, we just had our convention that we had in Colorado here.
Oh, you did?
And we had a convention, because...
Was it like the national convention, or?
It was a national convention. Colorado is a brand new chapter, which I am the president of the Colorado chapter.
How long has the chapter been here?
The Colorado chapter?
Yeah, the Colorado chapter.
We officially just became official this past month, 2 months ago.
Oh, you're very brand
But
new.
there's only 5 families, and we're just 5 families in Colorado. But we had to get it started because of the need. So we got it started. So we raised, actually, just our community in Colorado and the convention, we raised about $24,000 just
that's
in 2
great.
days. That's just a little seed money.
Yeah.
That's just a little seed money to kind of say, hey, this is one thing we want to do. We want to get started, and that's giving us the little pep to come on, let's go.
That is
It's
very
a great
good.
feeling.
So how did you get involved? Did you find out about the organization through somebody here, or how did you find out about Akusa?
But Akusa, well, I am, like I said, I'm the president, and I can give you my email address. It's cagu@earthlink.net. C, my initial C, and my last name AGWU@earthlink.net. That is my email address.
And what's your phone number?
My number here is 720-339-3482.
Okay, say that one more time.
720-339-3482. That's my cell phone number.
Okay, and if somebody is wanting to get involved, they can contact you.
Definitely.
Yeah.
Contact me.
So hopefully people from Nigeria are listening that live here, and they can contact Agu and just tell them, hey, we'd like to help out.
That it really is a good idea to get the people that are from there, because a lot of people want to help, but they don't know how. when one start a light, everyone can see where they're going. So I think that it's awesome what you're doing and what you have going on here. I think it's wonderful.
Yeah, we appreciate it. It's giving us the opportunity to let people know out there what we're doing.
If everybody just do a little bit, you know what I mean? That's all it takes, just a fire, just a spark. And everyone just, from whatever country you're from, just, have the heart to give it back just a little bit. And if I think you start an awesome fire there.
Oh, definitely. And what we'd like to do, because we think you have a very extraordinary organization, is to be able to, talk about having a group on our site that people can come on at myfavouritenonprofit.com, and it's like a social community, and they can come on and actually find you on there and follow you there as well. So it'll be additional exposure. And we'll talk more after the show about that.
Okay.
Yeah, very good. Is there anything else you'd like to say in our closing moments here?
Well, we got less than 2 minutes.
2 minutes left.
You know what I always tell people? We are like, this is where we are. We are like a little story about a little boy that did. I tell you what I'll do it after we come back from break. I'm so excited about what I'm going to say now.
No, this is going to finish, so you get to do it now.
There's a little boy.
This is the end of our
There's a story of a little boy who came home and said, Dad, show me the picture of the world. And draw the picture of the world for me. And so Dad drew. The dad gave the little boy a piece of paper, said, draw the picture of the world. And the baby just did that. The kid did it in 1 minute. So the dad says, how did you do that in 1 minute? Then he flipped the back of the paper. What happened was, on the back of the paper, there was a face of a man. All the kid was doing the circle. The whole world came together. And that's the story for us. If we do, you said it earlier, if we all do our little thing, the whole world will be okay.
Right.
But everybody's worried about how can I move the world? You can, one at a time. That is you doing what you can do, me doing what I can do, I doing what I can do.
Yes. That gives
That's
me
beautiful.
chill.
That's
This is
something
true.
else.
Yeah, there's an organization called Up With People we hosted the gala for. Elena was there actually. And with that organization, they have us, they do singing and promoting of peace and unity throughout the world. And one of their songs is, what can I do as an individual? And they're trying to get across the message like you're talking about. Each individual can make a huge difference.
Exactly.
Yeah, and that's why I started our company, My Favorite Nonprofit, because I felt nonprofits need more exposure out there.
Yes.
And so by doing that, we have a platform that you can come on
Yes.
and people can find out about you.
Thank you for that.
Oh, for sure, it's my pleasure. Because as I said earlier, if you don't know that you exist, then people will never be able to get involved.
Exactly.
And that's the key. And I found out in the U.S. there's 1.8 million nonprofits right now.
Wow.
I said, that is amazing. So what we'll do is that we'll talk, like I said, some more after the show. So I'll show you how our groups work, and then people can come on and follow you, and we'll be able to promote you some more.
Right.
Very good. Well, that was the first segment, and so we're going to go to a break, and then when we come back, we're going to have Francisco Merval, and Francisco is with the Hispanic Christian Chamber of Commerce Foundation. Kind of a mouthful, but we'll have him talking about that. Agu, thank you for coming on. We really enjoyed having you as our guest.
Thank you for
Wonderful to
having
meet
me.
you.
You guys are awesome.
Thank you.
for what you do.
And again, I'm Ralph Grills with My Favorite Nonprofit, and we have Helena Nee as our co-host. And you can find out more about us at myfavoritenonprofit.com. We'll see you after the break.